Horizon Treatment Services, inspiring hope and healing since 1976.
Well, hello, and thank you for joining us today. Welcome back for another episode of Horizons Podcast. We have a very interesting conversation for you today. We are here with Remington Rainey from Pulse for Good and one of my colleagues, Eliseo Becerra. I'm going to let them introduce themselves. Today we're going to talk about transparency, technology, and the necessity of safe feedback in behavioral health. So let's start by introducing ourselves. Either of you, go first.
Yeah, I'll go ahead. I'm Remington Rainey with Pulse for Good. I'm the CRO and co-founder, and really probably a better title will be just Chief Value Officer. I like to touch base with all of our clients and make sure that we're providing the value that we promise in our product. But Pulse for Good is a client feedback platform that allows for safe, honest feedback to come in specifically for human services organizations.
Wonderful.
And my name is Eliseo Becerra. I serve as the Chief of Strategic Growth and Special Operations for Horizon, formerly the Chief Compliance Officer as well. I was very intimately tied in with outcomes as the Chief Compliance Officer, so a big part of my role was making sure we had the right tools in the right place to be able to source data for being able to have a good solid dashboard and kind of a window into our programs so we can be able to track not only client satisfaction, but outcomes as well. And currently in my role right now is being able to continue utilizing these types of systems in what we do to be able to tell the story of what we do here at Horizons.
You know, and in that spirit, Eliseo, to be able to tell the story, I'm the Director of Outreach and Talent Development, which means I do a handful of things, one of which is the storytelling of our organization. So the marketing type things. And so this has been an incredible tool for me because I have hopefully everybody in a position like mine does, but I have a deep desire to be authentic and have integrity with what I'm marketing. And so I like to make sure that the things we're saying about our programs are actually reflecting the experiences of staff and of clients. So if you could start, Remington, just by telling us about the organization. How did you start? What was sort of the impetus of the beginning of this program? And we'll go from there.
Yeah, absolutely. So it's actually run by two brothers-in-law of mine, and it was actually my wife's younger brother, and then my wife's sister's husband is the two guys that we started with this, and we end up just spending a lot of time together as family. And really we knew we had the skill set amongst ourselves and a couple other friends to build a product. So ultimately we started out, hey, we want to build a product, and we met together on a Monday night, and we're coming up with ideas. We had some ideas, and we said, okay, next meeting, come back. Let's everybody come back with their top two ideas, and then we'll talk about those. And the one that came in the top, mainly because I think two of the three came back with a product that was employee feedback, and really just a way to get honest feedback to management without like, hey, I feel like I'm getting underpaid, I want to get a raise, any of that stuff. And I think a lot of it came to fruition because of things that we were frustrated about inside of the organizations that we worked with. Great organizations, there was just small tweaks that we wish we could say, like, for example, getting a raise. If anyone, I don't think this is unique amongst any organization. If you figure it out, great. But I feel like as some employees, at times to get a raise, you have to come to the table like, I've been offered by another company, and that's how you start the raise conversation. There's got to be a better way than that, is what we thought. And so we created an employee feedback platform, and we were pitching it to go get seed funding. We had dreams of having, get a bunch of VC funding and all these things and have it be one of those giant SaaS companies. And we went and pitched in a Bloomberg competition And afterwards, one of the judges on the panel approached us and said, "Hey, this is a really unique idea. I know it's not what you guys do, but what you talked about is exactly what we need for our programs that are designed towards helping youth experiencing homelessness in the Seattle area. And we just cannot get any feedback from them. And we feel like it's because either we're not talking to them or offering them a platform where they'll feel comfortable talking, or our programs just aren't helpful and they refuse to tell us and they don't know which it was. So they had no way of improving. And we thought some more about it and we realized, hey, this is probably going to be a side gig for quite a while. At this point, we've been doing it for about a year, maybe like 6 to 8 months. And we said, that feels like a lot better place to spend our extra time and energy on nights and weekends to a solution that is going to help just society in general. If all of our human services programs can be 1% better every month, every year, every 10 years, that's going to improve. All tax dollars go towards these programs, grants go towards these programs. And we said, let's just be a part of improving those organizations because we feel like they're really important. And so we went back, we tested out, we talked to a couple of places here in Utah where we had connections and did a couple pilots. And we just learned quickly that this type of platform is highly needed because of the number of hats that people wear inside of human organizations. They just didn't have the bandwidth or the technical expertise to get some of these tools in place. And so that's where it was born about 10 years ago. And I think we started actually offering pricing and things like that to clients about 3 years in. And I think about a year after that is when we ran into Eliseo and Jamie at Horizon Treatment Services.
Well, I love that story. And isn't it something about just put one foot forward and, the need will present itself. So I just think that's a really neat story because you guys knew you wanted to do something, but you had to get out there to find it. Yeah. Right?
Yep.
So how did you find out? I think you had told me a story once about sitting down with some young people who were living unhoused and getting a sense of what it is that they needed.
Yeah, as a part in that process, we were debating. It was actually kind of the dead period in between when we had been approached by that city council member in the Seattle area and trying to work out a pilot with some human services orgs, specifically homeless shelters in Salt Lake City. And we were at a conference, and Blake was going out to going and grabbing a bite to eat. We would take turns. Someone would stay at the conference, and he saw a man obviously experiencing homelessness, and Blake had said, "Hey, I think he had asked him for money or something," and Blake said, "Hey, I'd be happy to, if you haven't eaten today, I'd love to have you grab lunch with me," and went in, got him lunch, and sat down. And if anyone's ever done that, I personally have found that it's hard to get a lot of conversation out of some of those individuals. They're just on guard. And Blake was able to get him to open up a little bit and said, "Hey, we're actually trying to work with a couple homeless shelters here in the area. What do you think of them?" And just started kind of asking him, trying to get insight from that side of things. And he said, Blake asked him, what would be probably the biggest thing that would make that stay, or whenever you're there at the shelter, better? And he said, "I wish they would just listen."
Wow.
And that caught Blake's attention. He's like, "That's exactly what we do. And that's exactly what we're hoping to help these organizations with." And it's definitely not for a lack of wanting to listen. It is absolutely a bandwidth thing, bandwidth and a system and process thing. So that, again, was just another piece that solidified, hey, we're in the right place. We may not be that company that sells for $1 billion or whatever, and now we've changed. That's not our goal. We're a lifestyle company, and we want to provide good jobs here locally for good people and a stable environment. And really, we've had a lot of clients tell us we love that we can get a hold of just about anybody inside of the organization, and we've made that purposeful, intentful change. And I think it's been a game changer for our clients to see that we're not trying to be the biggest, but we're trying to be the best at our specific thing, which is feedback and helping organizations improve.
Well, thank you so much for that. And it's been our experience too, as we've sort of grown alongside you. We've been around serving the community for almost 50 years, but in this last iteration of ourselves, post-COVID, we've had to do a lot of growing and a lot of changing some of the ways that we do things. And I think we've been working together for about 6 years, 5 years. Is that right?
Yep.
Horizon and Pulse for Good. Yeah. So we've done a considerable amount of growing alongside each other. Eliseo, speak to your experience in finding each other and sort of how we've benefited. Some of the specific examples that you've seen us benefit with giving clients and staff, because we use it for clients and we use it for staff for anonymous feedback. What have we found, Eliseo?
I think the biggest thing was Horizon Services almost like 5 years back. It was like being on a mission with an entirely like developing a new leadership team, right? And as well as Jamie coming on board and being able to come into an organization and assess where your, feedback portals are for staff being able to reach out to leadership, clients being able to engage leadership or provide feedback. What we were looking for was to source the ability to be able to hear out from our programs and be able to have exactly what, I mean, no pun intended, a pulse check, right? A pulse for good, and having a pulse, right, on the business, and just the care part of the programs. So when we ventured on to this journey, it was also taking into account the type of surveys that our clients receive annually from the state, and because some of our facilities are state licensed. So we were like, we're already doing something like this annually. We have to do it, right? But we don't want to just have to do something. We want to be able to do it all the time so we can really see what's going on and address our staff and our clients in real time. So as we ventured onward, we really saw that we saw that data is everything, right? And that's one of the things that for the longest time in my career is being a leader and being in the role of responsibility for patient or client care and even your team's care is just you want to be able to source as much information and be able to paint a picture of what's going on. So we really saw that opportunity to engage with someone that is going to be able to get us that information and also be able to kind of hand in hand customize, build, and be understanding of what our expectations were, So just alone by implementing Pulse, we've seen the abundance of information consistently. I mean, from clients letting us know about food quality so we can improve the quality of our food, all the way to our staff giving feedback on the types of supplies we need, specifically one EMT coming forward and providing feedback to us to be able to say, we really need X, Y, and Z. I feel like we're not getting it. And us to be able to jump in and say, well, let's take a look at this. And then that becoming now that supply item becoming a standard when we set up new programs. So it really levels us up.
That example, is that the scissor comment that came in through the either the stakeholder or the employee feedback inbox?
Yeah. It led us to take a look at not just the scissor, right? But an entire EMT kit pack that they would need to be able to attend to an emergency and have those supplies readily available. So it really just flourished into something more that we could provide better care to our clients in emergency situations.
Well, and in a continuous improvement organization, no matter what it is that you're doing, we of course are in behavioral health, but I mean, you've got the folks who are working directly with the clients. I mean, they should be the ones letting us know, where the gaps are. And so we've built this culture, and I've heard of other companies too, but I would encourage folks to really think about the value of creating the culture where there's an open door and also an anonymous way to get the information that's needed. Because, there's power dynamics. And I think it's really important for folks who are maybe currently unhoused or in the, grasp of their addiction or whatever it is, one of the lowest times in their lives, to be able to have a safe place to say what they need. Um,
Absolutely. And to reiterate that, if it's okay,
mhm.
just I know that you've got certain audiences that will listen to this, and behavioral health and SUD services, and then also Horizon employees. Everyone should know, like, it was awesome getting to know Jamie. That's one thing. We definitely have our set of clients that we understand, we just jive with. Like, they get what we do and we get what they do. Oftentimes they get more what we do and why we do it the way we do, more than we understand anything about the services you offer. But with Jamie, we got off to a good note instantly. Him talking, we got on a Jim Collins kick, and him talking about would be great, and all of the Jim Collins isms. And it was clear that Jamie just didn't want to do good enough. We
Yeah.
definitely can. Some of our clients, it is something where we realize, oh, you know what, they're doing this. This is a compliance checkbox thing for them, and which is okay, absolutely okay. It's not a problem to do that, but you can tell when there are the people that look at it and say, no, we don't want just the compliance checkbox. We literally want to get better, and we have thick enough skin to take those
Right.
constructive comments that come in, and all the way down to, hey, no, we don't just want this for our client feedback. We need to make sure our stakeholders have, the people that are partnered with us, have a place to say, you're communicating with us too much, too little. Uh, this isn't going well in our handoffs, and then vice versa with employees. That Jamie made sure that once we got all the clients surveys created and handled, and for those that don't know, Pulse for Good, the unique thing about us is we believe strongly in anonymity. And one of the ways that probably the best way that we know of to create a psychologically safe environment and to get constructive, honest feedback is kiosks. So no camera on them. It's an iPad mounted in a thing. Definitely not a novel idea, but you wouldn't believe the upkeep in the background that needs to happen to make sure they stay on 24/7. And to Eliseo's point earlier, to have that pulse survey always available so that we are telling people, hey, we're creating an environment of openness and honesty and transparency, and we want your feedback 24/7 if you'll give it to us. So we implemented the kiosks at your different sites, and then from there he immediately went into, okay, now we need stakeholder surveys, and a lot of this was Eliseo as well, saying, hey, we don't have a stakeholder survey, and HR side saying, let's get an employee feedback inbox going. So lots of different tool sets, but Jamie wanted them all, and it just goes to show it's a relentless improvement process there at Horizon, and we really love seeing that.
Oh, thank you. Yeah, it's a real joy to be a part of it, if I'm honest with you. It's hard work. I mean, I'm not going to just
Absolutely.
fluff it, you know, it's a lot of hard work. People in this industry are always working hard because it's very hard work what we do, and meeting people at their lowest place often, and trying to lift them up. But it's critical that we keep the standards high, and it's critical that we provide the best service to folks, whether they have insurance or they don't have insurance. They deserve good care.
Yeah.
Um,
You
Yeah.
question just on my end. It's
uh-huh.
anecdotal. We're curious about it. We will, when we're giving presentations on Pulse, one of the benefits we think is there is the ability for clients to vent. It's a human nature need sometimes, so much so that some of our clients who don't have like a Google or a Facebook services page, they've had their clients go create a Facebook page just so they can vent about that company.
Wow.
You don't want that happening. But what I'm curious about is, do you think your staff, since implementing Pulse for Good 6 years ago, do you think it's improved employee retention, or do you think there's a little bit more of a sense of, um, I guess, is there a nicety to having those kiosks in place or that feedback in place so that staff can just kind of say, hey, Eliseo, I understand you're upset. If you want management to hear that, I need you to go over to that box. Have you seen anything, noticed anything?
Yeah, yeah, we've seen feedback like that, and I think like on the side for staff, having that available tool, right? And I can't help to think of like a lot of stories we hear where it's like leadership will they don't listen, and I send things and they don't listen, they don't do anything, but for us, it's a big deal because we like to do like closing the loop of like follow up and feedback and assessing that information and trying to be able to make sure that we let staff know what they need. If they let us know who they are, we love engaging with them and trying to find resolution or solve what might be troubling them. Sometimes it's anonymous, so we try to incorporate all that feedback, and that's where we're very transparent. Like we listen, and that's where Jamie is embedded in our culture, and we really took it to heart, where we're like, we want to challenge ourselves to be able to be better and do right by our staff, so they know they're working with a group of individuals that care as much as they do, right? And we've seen a lot of feedback come in. We even get constructive feedback about other staff, like shout outs, which is great. But we take all the opportunity out of every comment we can to be able to infuse it in our strategic goals, our initiatives, program follow ups, tools, and systems. And it goes a long way. And we've seen a huge change in our culture, especially when it comes to our serving of our employees and scaling out how well our employees perceive our workplace, right? And those perception surveys have been really stellar, right? And it's made a huge impact to show like this is a great place to work because you have not only competitive wages, you have the benefit package, but you also have leadership that's here to listen, right? And if someone isn't listening and you feel like they're not listening to you, there's going to be someone who will, and that portal for them to have access to that gives them that opportunity to bring up what their concerns are.
Well, and go ahead.
Well, the same goes for our clients, right? That's like the biggest thing because we've incorporated in our system where it's like they can give long comments and we will get chunky ones, right? And that's where, I get excited. A lot of us get excited because we're like, ooh, something good to read. Let's see what's going on. What do we got to work on here, right? So you get the inside juices of what's going on in that program, and you start piecing together like what might be going wrong or what might be going well. But that's the fun part of it is it's a puzzle to figure out and solve.
Yeah, and I was going to say that's a great question, Remington, and thank you for all of that, Eliseo. You touched on a lot of what I was going to say. But I would also say what I have found in a few circumstances is for staff anyway. There are still folks who don't entirely trust that it's anonymous, which I swear you it is.
Within Horizon, you're saying?
Sure, there's skepticism,
Yep.
and probably for good reason.
Yep.
I'm sure that people have had experiences, if you say, I work as the director of outreach and talent development at Horizon, but don't use my name, you're going to know who I am, right? So you got to be careful with identifying factors if you want it to stay anonymous, but typically it is anonymous unless you say your name. And some people choose to say their name because they want to be gotten back to, right? But I have noticed, and I've had people tell me on the staff, two different instances, Jen, I don't trust that is anonymous, and I don't want to put my concern in type because then there's a paper trail. But instead of doing it there, I actually went to my manager as what felt like a better option. So interestingly, even having Pulse for Good there initiated a desire to speak to the manager instead of just letting it go.
Yeah.
So strange, but interesting little nuance, right?
Yeah. And it's that trigger, right? Horizon is asking, hey, we want your feedback. If there's anything of concern to you, we'd love to know about it. And it triggered that thought that wasn't psychologically safe, which goes for them. And I get it.
But
Any
they had
text or
options.
email. Yeah, they've got options. And it even speaks better to that manager and to Horizon of, hey, my relationship of trust is not with this third party software, it's with these people.
That's
Great.
interesting.
If we can push people there, even better. Yeah, absolutely.
I love that. The last thing that I wanted to say really quickly before we move on from this is I don't have the data. I wish that I had have thought of that before we got on here, and I'm sure that there is some. But in terms of clinical outcomes, when it comes to using a service like the kiosk and the feedback portal that's anonymous for clients, you said, do you find that people vent in them?
Yeah. Yeah.
And yes, we have had, particularly at sobering centers, detox centers, when people are within 24 hours to 5 days of their abstinence from a substance, life is really hard and you're really uncomfortable and irritable and upset. And I would venture to say that some of the long submissions that we've received allowed somebody to go to sleep instead of go out the door.
Oh yeah. Yeah. We don't have any statistical data on that. Obviously, we'd have to know who the person is to say, hey,
Right.
was that helpful to be able to vent? Interestingly, doing this for 10 years, the biggest thing that we've found that I personally have been surprised about is how reasonable people are. They, especially when they know that you're listening. I know that Horizon, we worked with you to implement the You've Said, We've Heard boards. So it's a way to close the feedback loop. Ultimately, that's what Pulse for Good is doing, is helping organizations improve their feedback loop. And the first steps of those is asking, collecting, analyzing, and then the last steps are implementing and notifying. So implementing is if there's a change we want to make or should make, we do it. And then it's not just making that change. Some people may notice that change, but it's letting them know. Even if it's something that's not implementable, we can notify them and say, you said hot tub in the lobby, and we said, we love hot tubs. It doesn't mean you have to, everyone will read that and be like, oh, they actually listen to those things. We put that in there as a joke. We know that. And
Right.
it's cool that management can read that and say, oh, that's funny. We would love hot tubs too. So kind of cool. But going back to the numbers, it was interesting. If we run all of our data collectively with sentiment analysis, and not just sentiment analysis alone, but of all the comments that come in open text, it's actually outweighed positive comments to negative comments, which you think of the services and the organizations that we work with, you would think it would be completely lopsided, like completely. And we anticipated that. And we're perfectly surprised that it's the opposite. And I think probably I would bet Jamie and Eliseo, when we first rolled this out, I bet you guys all have been surprised at the positive comments that come in.
Absolutely. Mm-hmm.
Yeah, we get a lot of positive feedback, which is really good and motivational for our staff too, because when we share that, is they're able to see like all that hard work is paying off. And then also, I can't help to think about when we think the clinical outcome of them having that access point to be able to share those items that they might be struggling with, is just, it leads us to be able to say, hey, do we need additional training for our clinical staff, right? Or like, are we doing what we need to hear them out? And then also, I mean, it's also the environment is a huge factor for our clients. Positive outcomes are directly correlated with the environment they're in. So if we're able to assess what's going on in that environment and make that environment a little bit better for them, it'll definitely have an impact on their outcome for sure. The biggest thing too for me is like staff safety. I can't help to think about how impactful it is for staff safety, because it's actually been used as a de-escalation tool as well. Sometimes clients are in a place where they are having a hard time comprehending certain things, or they want to express a certain way, and staff aren't able to probably manage that situation really well. So they'll direct them to a portal, to a kiosk, so that they're able to give that feedback, which is like very impactful, which prevents situations getting a little bit more out of hand.
Yeah, absolutely. I love this conversation. I wanted to bring something up along the lines of allowing our clients to speak directly to us through this tool. One of the things that I've noticed about Pulse for Good is that it's super accessible. It's super easy to use. And I know that's critical for our population, not because our population needs simple things, but because our folks are in distress. And when you're in distress, you don't want to have to figure out technology, right? To express yourself. Can you tell us, how did you come to the design that you have?
Yeah.
What's the value of what you chose in terms of the stars versus emojis and that type of thing?
Yeah. So we actually we started with the assumption that we know nothing, which was actually really, really true. we, our first premise was, will anyone actually even answer these questions? Any question?
Right.
And we knew we didn't know at the time that there was some philosophy behind it, but we went to the experts. We had Mark Johnston, who was a White House advisor on homelessness, and on our advisory board we had a couple other PhDs on surveying that were here at the university, and we kind of went to them and worked with them on these, and it's accessibility. It really comes down to that. The way that we arrived at the hardware was it was an interesting, psychologically safe, huge benefit that we implemented unknowingly. The reason why we arrived at the hardware was working with people experiencing homelessness or the unhoused in those programs that are available. We knew by asking that we couldn't count on anyone having regular access to a data plan or a phone in many cases. That's becoming more ubiquitous, but
Yeah.
at the time it definitely was not. And so we went and said, what would be the lowest common denominator and most convenient and quick way to give feedback? And honestly, again, we were ready to put that on the shoulders of the service providers. And when we sat down with our favorite, Catholic Community Services here in Salt Lake, they were our pilot. Awesome executive director there, Matt Melville, said, we're an open book. Let's try it all. We know we have plenty of things to get better at. And if we can't prove that we're at least trying to get better, then we may as well not start. And so he was an open book that way. And we went and sat down with his team and we said, okay, what does your IT team like to use and what's your tech stack? And they kind of looked at us and we could see the deer in headlights look. And then they said, I think you mean Ted. And I said, okay, yeah, who's Ted? And they're, well, Ted's a volunteer and he comes in on Thursdays and he's here for 2 hours. And that was their IT team. And we realized, oh, we're going to have to do a lot of this. And so we quickly pivoted and said, okay, we're no longer just software, we're software and hardware. And the cool thing that was born out of that is that right now, based on our data that we have, is you are anywhere from 11 to 13 times, you'll get 11 to 13 times more feedback from a kiosk that has no camera and it doesn't ask identifying information, so an anonymous survey. But because there's no camera and they've never interacted with that, it's actually 11 to 13 times more likely that you'll get a response, or you'll get many more responses than a texted or emailed survey. You were talking about it earlier about one of your employees that was like, I don't think this is really anonymous.
Right.
Why did they feel that way? It's because that I know that the Horizon employee feedback link gets sent out via email and plugged into newsletters. It's a digital survey that they're taking from their personal device that they have everything on there. And all of a sudden, some red alert bells go off in your head and you're like, I don't really trust this. Even though we do not cookie, we do not pixel, there's no way for us to know where that survey was taken from. But it's a psychological safe mechanism that kicks in the human brain. Yeah. And it's way more safe to just use a random machine. And it's funny, we see it all the time in spy movies, right? Where will they go? Back when payphones existed, they'd go to a payphone, they go to an internet, right? Machines are never used. That's the safest. So,
yeah,
now, we're just actually just teaching everybody how to be spies. So.
There you go. I know. Who knew that was going to be a byproduct of this conversation?
Yeah, I know. But in that survey design and the accessibility, the stars, that's just universal. Everyone wants emojis because they're cute and fun. Different cultures have different uses of each emoji, and sometimes entirely different emojis. And so the star ranking from a psychological and an accessibility standpoint is the best way to start. If you want to say this is an easy, approachable, quick survey, that's where you start. You can absolutely start with an open text question. Everything's customizable to your liking, except for we're not going to ask patient information or identifiable information. We'll definitely do demographics and those things, but that's where we arrived at those, is a little bit of iteration, but a lot of insightful information from people who've been in those fields.
Absolutely. Well, and I love that especially too because I focus on the class committee here at Horizon, which is culturally and linguistically appropriate services, which is a lot of a tongue-tying way of saying that we want to be accessible and be safe for anybody who shows up to our doors, um, regardless of whether we have a full understanding of culture, religion, tradition. We need to be able to serve and serve with equity anybody who arrives to us. And so I appreciate that your organization considered that and considered that with the stars and understanding that across cultures. I would love if you two would do what I've heard you do before, and that is sort of geek out about the tech and the AI. I'm really interested in I know that there's probably AI that is used to sort of create the story out of the data to create a little bit of context or something. But what else would you say is part of this that I wouldn't understand? Talk to me like I'm a 2-year-old.
Yeah, well, we can get into all kinds. There's other tech that, I'm interested in hearing about what's cutting edge in SUD and behavioral health services. From what we use on the Pulse for Good side of things, that's the open text analysis is sentiment analysis. We're just putting that engine inside of our tool, like many other companies are doing. We've been doing that. We actually trained our own large language model on sentiment analysis. And it was 1,500 comments at a time. So Blake, myself, and Mark would each week we every 3 weeks we would just split it up. One person had the sentiment analysis training task for the week, and we would literally go in and rank it. This is a positive comment. This is negative. This is neutral, and over and over and over until we got through the 1,500 comments for that week. And then it was Blake's turn the week after that, and Mark's. Not a perfect science behind it, but definitely better than nothing. And we had that in our tool before ChatGPT was even a thing. Now it's super fun. We've got it down to the point where even though we were previously offering languages inside of our tool, you could, as I know you all have Spanish and a couple other languages, especially
Right.
is it Alameda County? That
Yeah,
it's
we're in Alameda, we're in Alameda, Santa Clara, San Mateo, Chico. We're in New Mexico now.
yeah,
But those
all over.
language
So
requirements or those language thresholds, I mean, they're everywhere now, right? So
yeah,
Yeah.
in order to have good access to care, it's like you need to be able to understand the community, including like, now that we're out in New Mexico, they have their own set as well.
yeah, for sure. And now it's awesome for Eliseo when someone puts in an open text comment, whether it's the voice to text or they actually type it out, it's going to come back and translate it into English, so
So
that we're not spending more time. And again, that's the whole goal for Pulse for
Wow.
Good is automate the front end of that asking, collecting, analyzing feedback loop, so that we take the hard, tedious, boring part out of feedback and let you hang out in the implement and the notifying stage, which is where the real magic happens, right? Of course, gathering that feedback, getting someone to give you feedback. And so we can't wait to see what AI does to improve our product. And we're always taking comments and feedback that way. But like I know, Alicia, you and I hopefully appear this summer at the Sobering National Sobering Conference. I think we're presenting on
yeah,
technology. And I know Observe Smart is one of your vendors that we see at conferences as well. And tell me a little about what they do. I'm sure they use some AI, but I think their product is just cool for the business that
yeah.
you're in.
The whole thing with AI and technology is just I think it's just from what I've seen in my time is and I remember it's like there was a time where it's like you didn't have a cell phone even access to, right? And then like now you're here today with us and you're chatting about, oh, the computer's going to tell me exactly what I need to know, right? So, and we've always been big advocates of like trust but verify when it comes to data, but AI is the ultimate tool to make things a little bit more easier for us, especially when it comes like to observe smart technology. Is like we talked about how now Pulse is able to give us the feedback from what our clients are feeling or thinking by them sharing that information with Observe Smart. We're using Observe Smart to strictly focus on like how safe our clients are being monitored and where they're at in our facility. So They've actually been able to grow their system to have a component where it's able to let us know where a situation might be coming into play. For example, clients might be fighting in the restroom, right? And staff would be immediately alerted. How? Because clients are wearing these beacons and there's these sensors that will pick up if those beacons are in a certain type of motion or vibration that would trigger that there needs to be an alert sent to staff. Um, and the reporting itself, they're able to give us reporting whether we're falling in with appropriate thresholds and benchmarks and according to what, we can set and customize, which has been amazing too, because I would say when it comes to Horizon, we will always say, "Hey, this is good, but there's good, better, best," and we want to be better than good. Like we want to be striving for more. And with AI and technology just deciphering things for us is just made workflow efficient. It's been more effective in being able to review our reports and understand what needs to happen. And like the biggest one too, like I've been a huge advocate for this. It's just being able to give our staff more time with our clients. If they're not fumbling through writing paper logs, things like that. And I can't help to think, and many of our listeners will attest to this, is how much time do you spend documenting, right? So that's one of the tools we're trying to work with now is being able to record our counseling sessions so that AI is able to be able to build out a note package for our staff. So it's like less time filling out, typing, writing up notes, more time with your client and being able to spend with them. So that way you have a more efficient day, and your performance isn't wavered down by like just the administrative burden that so many of us face nowadays.
Well, and not only that, but you talk about the administrative burden. I mean, we're talking a lot of times in our field and in different counties. I mean, you're doing double, triple entry into multiple,
Yeah.
electronic health systems for the county, for your company, for the hospital. I mean, there's all these different places that are not communicating yet, right? So,
Yeah.
the amount of time that somebody spends in this field or in the medical or healthcare field in general documenting. It's critical, it's necessary, it's
Hmm.
important, but also the care that people deserve is person to person.
Yeah.
Yeah.
And so all of these tools, if we use them properly, they don't replace people, they give people back to people.
Yeah.
You have people back to people. Yeah.
Well, that's
Yeah.
the
And then,
really that's what we're aiming to do at Pulse for Good. It's those tedious activities that have to happen. Sometimes Eliseo knows that it's a compliance requirement, like we have to do certain things, and that's just needed. But if we can do it in a way that, to your point, Jen, of letting people interact with people more, Pulse for Good is not. We can't tell you what to improve. We can make it easy to get in those improvement tidbits that people recommend to you, but you all are the experts at what you do there, and the people that you've hired to do that are amazing at it. Let's not bog them down with having to do this busy work. It makes me think of my kids in school, and sometimes I'm just confused when they come home with 5 pages of homework, and I'm like, "You've been at school for how many hours?" And
yeah.
so that's a whole different conversation. But
Yeah.
really, we want to. We've all had that experience of being in the doctor's office and telling him the whole thing, and his face is at the iPad or typing away, and it's just not a very personable experience. If we can get back, of course, we prefer this. Like, hey, what's going on with you? I want to hear. And if they can just be engaged there, if we can give that back to every service provider, we know there will be improvements. And in that case, hopefully, maybe if our product has to become obsolete to make that happen, because the relationship of trust is so high, then awesome, even better. But right now, we know that's generally not the case. But you better believe we've explored every way of seeing how we can be cutting edge in surveying, even to the point of like I'm the guy that gets made fun of by my wife, that she jokes that I love robot vacuums almost as much as her, and I do. They're amazing. Like that was my job. I signed up. I said, hey, I will sweep him out the floor. I know she appreciates a clean kitchen. Most of the work's already done by the time I get home from work, but usually the floor's a mess. by the end of the night. And so I handled that. And it saved me a ton of time to be engaged with my family more, right? So you better believe that Pulse for Good has messed around with robots and that idea. Now, do I think a robot walking up to someone to ask for feedback is going to get more feedback? No, it's probably creepy and weird. And but this is a little bit of insight. Something for Eliseo and the team to look forward to is we're messing around with allowing clients to take you to where they're thinking, and it's through AI prompted surveys. Just say, ask one question, one prompt. So it's almost AI in reverse. The survey will prompt them with, "Hey, tell us about that experience," and then our product's going to listen and take them down a path. Now, you're going to get different feedback, and it's going to be hard to benchmark. There's pros and cons to this, but you better believe we're going to be reaching out to pilot that with you and see where that can take us. But ultimately what that does is it's saying, instead of Horizon or a provider saying, here's the questions we want to ask and here's the only things we want to listen to you, it truly opens the door to let the client say, here's what I'm feeling and thinking, and it allows them to direct the path while still being able to gather the data and someone not being a bean counter, typing everything in and trying to figure out what the client's saying. So there's some cool stuff on the horizon.
It sounds like, pun intended.
Not a pun.
Yeah, nice. It sounds like it's almost technological motivational interviewing, right?
Yeah.
Which is what we use in working with our clients, is sort of finding out where they're at and sort of bringing them through their recovery at their pace, based on what's important to them versus, a strict letter of questions to ask them and bring them in one similar path, right? Before we get too far off of this, you were talking about robots. Eliseo, I would love for you to share some of what you experienced in school. Could you tell us that story?
Yeah. So recently obtained my MBA this past year, and it was such an incredible journey because I went in open-minded, and I was like, Jamie went to the University of Colorado with, to get all this information to be able to be a great leader. And I used to speak very poorly on MBAs. No offense to any of the MBAs listening here, but I was not a believer. I was like, they don't like to roll up their sleeves, or they don't know what they're doing, right? And then I met Jamie. I was like, maybe there's something to this. And I went on this journey, and I ended up in Asia. I ended up in Taiwan and in South Korea, and my mind was blown away because even in the coursework, they started incorporating AI utilization, a lot of technology for healthcare, right? And here I am in Asia, watching these robot nurses dispense and deliver medications, right? And I'm just like, what? And the nurses, I was trying to source feedback, and they're like, I have more time to be with my patients, to be a nurse, than to get bogged down with dispensing medications, right? And it was just amazing with where it was going, because in healthcare in the US, we're seeing shortages of clinical staff, nurses, and everyone's having a hard time out there trying to staff. And sometimes it's like, well, if we don't have the proper staff, well, how can we give our staff that we have right now the capacity to do what they need to do, and we can remove some of this work where they're getting bogged down with, right? So it was just so amazing to see how they've incorporated technology in their hospitals there. They have their patient check-in set up very conveniently for when patients walk up. They're able to check in. I saw the sweetest older woman come up to a tablet on the wall and punch her information in and get checked in. And I was like, this is like someone's grandma who just brought in the bus and is just walked up. And I'm having a hard time having my mom even still use an iPhone. She's using a flip phone.
Don't get me started on that.
And I'm seeing this little old lady just come in and boop, 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 boop. And she sat down, and I'm with someone who's hosting us, and they're like, and that's how easy it is. And I'm just thinking of my mom, I'm going to go back and I'm going to talk to my mom and go, look, you're getting an iPhone. We're fixing this problem. Because I was like, this is possible. But this thing is, technology as advanced and as intimidating as it can actually be formatted in an easy user-friendly manner, so that way individuals have quick, easy access. They can easily check in. It lets them know what room where they're going to get called, and it was just amazing seeing in healthcare. You go into some EDs, emergency rooms, and you're seeing chaos sometimes, right? And even bigger hospitals, and they're impacted. But these ones are big metropolitan hospitals, and it was just like an assembly line, very efficient. And they surveyed them there. They took a survey before they went in. They were able to take a survey when they left, just to see how impactful the visit was while they were there. So I was
Yeah.
just in seeing all that is anything is possible. Technology is making it easier for leaders to be able to actually understand what's going on with their facilities, their patients, their clients, and their staff. Is just we're going into a place that a lot of individuals are scared, but I'm always encouraging everyone just be open-minded, ask the right questions, and see how we can properly utilize the technology to just help people a little bit more.
Yeah, and I think you make a great point about just it's the tedium of the
Yeah.
monotonous tasks, of the necessary but redundant tasks. If we can turn some of those over to I don't know what the robots were called there, but I just think of Rosie from the Jetsons, and I know
Rosen, yeah.
we've got about 40 years before we're actually in the time zone or time of that cartoon. It was set in the 2062 or 2042 or something. So we're not
Yeah.
at Rosie yet. But I like to think about, again, giving the person back to the people, right? Giving the
Yeah.
nurse back to the patient, giving the
Yeah.
SED counselor back to the client. Because that time has so much to do with the quality of care. Uh, and we lose sight of that in the chaos. Um, well, guys, I have to tell you, I love this conversation. I think about the value of this feedback portal, whether it's for staff or for clients. I think about how we've used it for stakeholders. Eliseo and his team built out a survey for the EMTs and the law enforcement that come to drop folks off at our medical sobering center in New Mexico, so that we can make sure that our processes are also serving them well. So there's so many different ways to use it. And as was mentioned earlier, the you said, we heard, we did kind of boards that we have at all of our sites to sort of illustrate the feedback loop. I'm still waiting for somebody to put in that they want a jacuzzi or a hot tub, because I can't wait to be the one to answer that.
There's some nuggets in there, I'm sure.
Yeah.
I'm gonna
Sure,
go.
we
I'm
could
gonna go
raise
use
the
the employee
funds.
portal next. You'll see that coming soon.
Yeah, let's just, hey, if enough of us say it, right?
Jamie's gonna be
Um,
like, "Okay, you're letting LSL have too much fun now."
yeah,
Wait a minute,
something's going
someone's
on here.
collaborate.
Wait a minute. Why is this
Yeah.
trending? Yeah, that's hilarious.
But I will
Um,
say on the Pulse for Good side of things, like number one, we've enjoyed so much growing with you and that partnership that we have, and whether it's uh, Pulse for Good inside of Horizon that's triggering a thought and allowing and you all doing such a good enough job to allow that relationship of trust so the employee goes to a manager directly, or whether you've created a safe enough space. We're talking about moms and technology and things, and one of the things that's always struck me, a comment that came in the first couple of years of gathering feedback, was at a shelter, and the question was, "What do you wish were here?" And the comment that came in that's just always stuck with me is my mom. And so, number one, if
oh,
Pulse can
wow.
create that environment of safety so someone can be that vulnerable to say that type of comment, and then open the eyes of the organization to say, is there anything that we can do, whether it's homemade cookies or anything to make this place feel more homey? Let's do it. And if we can, again, to me, in my mind, that's improvement. And kudos to y'all for doing what you do, and we're just happy to be a part of it. And if we can empower you to continue to do more of that, let us know how we can help.
I appreciate that. I also, I know that you don't like me celebrating you much, but I'm going to celebrate you guys too, just because we don't, we'll work with companies to, get our needs met, so to speak, for the business agenda or the strategy. But you can't stay with companies that you don't mesh with, right? You just can't. It doesn't work. So I have to say that I have always been impressed that your team's desire to grow and expand and improve your product has always met us when we had an ask. Right. So Jamie will maybe, we'll be talking in one of our leadership meetings about, I wonder what this would say if we had the data to sort of draw this picture. What could we learn from that? And he would go to you guys and he would talk to you about the need that we've discovered. And you all will work until you figure out how to pull those numbers and how to parse the data that way and give us some of the information that we needed. And so that's not normal. It's not normal to have a team that is so willing to do that. So I appreciate your passion for what you do, and I just love working with you. I was going to say one other thing, and I can't remember. Did you have something, Eliseo, before we go?
Just on the vendor partnerships are super crucial. And when you are in a position where you got to care for clients, patients, and your teams, it's very important who you work with. And I think that's the greatest value working with REM as well as with Observe Smart, is that partnership as well as other vendors we have. I don't want to leave any names off because that list is super long, but I have found that just being able to have those open communications, that ability to talk through many of the situations that come up or brainstorm even the possibilities has been amazing. And I think anyone that's in a position of working in the recovery field or behavioral health field really needs to focus on those partnerships and really look at how valuable they are when you're trying to advance care for the clients ultimately and give your staff the experience they deserve from an employer, because there's huge staff burnout happening across the board, right? And if your staff's burnout, you're not listening to them, you're not hearing those things out, and you're not partnered with someone that can help you through that, it's going to trickle down to your clients. And that is very transparent. I've been around, I have enough experience now where I can say you can see it on clients' faces. But, when I go into Horizon programs, and I'm visiting and rounding, and yeah, some clients are in a bad spot, but other ones that are moving through the process, going through recovery, like you can really see it in their faces. They're having a great time. You're seeing groups happening. They know they're being heard. Staff is being heard. They're engaged. And it's just this amazing experience that
Yeah.
I think like leadership needs to focus more on making sure they have the right tools, the right partnerships, because I know with Pulse, you hear us out, and we're not easy to work with, and that's true. It's because when you have that kind of mentality, that growth mindset, it's kind of like both organizations are growing together, and it's just an amazing experience to see how much has come from it. So
Sure.
yeah, that's what I want to share.
Always wanting more and wanting to improve is a positive thing, even though it can be frustrating and tiring. I think it was Jim Rohn. If I could give some advice to any behavioral health or human services organization, it's Jim Rohn that coined the phrase, the power, the hard part is not in the receiving. The gifts are always there to be received. It's in the asking, and that's the challenge. And so, you had brought up that thing with Jamie earlier, is he had some data analysis needs. We had made some assumptions that people would have access to this, and he went on to describe why. Really, it was taking away from clients if he were to go hire an in-house or a data analysis consulting team. And yes, we absolutely have that expertise in-house, but we wanted to stay in our lane and just be the best at what we're the best at. And so we asked in return, on Jamie's ask, both of us asked for something, and we just said, okay, if you'll sit down and flesh out this report and your needs, maybe we can turn this into a win-win. And we now have a qualitative actions and analysis plan, which is a kind of an upgrade, an upsell. We generally don't try to upsell people, but when there's that need and we realize we can do it for a fraction of the cost of what it would cost an organization like yours, why not? That's a win-win. And Jamie helped us open that by asking. And so I would encourage all of you to ask more of your vendors. Don't be unreasonable with it. He was kind enough. We said, hey, you put in the time. We've got time with an executive team, a couple hours into developing this report. And we said, hey, that's what we asked of you. That was the sweat equity, if you will, into this process. And Jamie said, no, we're paying for that. Just send us the invoice. And, he asks a lot, but he also gives a lot. And that's great. It's a win-win relationship all day.
And as much as I love that we use your service and we value listening, I also want to, boast you one more time, if you'll allow me to. I know that you just wrote a book. There's a book called Candid that you wrote, and I encourage, I'm getting it, and I know that a few of us are going to get it, but we sort of probably helped you write it a little bit because we've been together for so long. Yeah. I say that in jest, but the point being, it's all about practical strategies to gather honest input, right? So people can close the loop, build the trust, and really so leadership can make the decisions that truly make the impact, right? So I would encourage folks to pick that up. It's at candidbook.com. Anything you want to say about what that resource can offer?
We actually had a client, it wasn't you guys, it was a different client that just had asked us, like, do you know anyone that talks about this and are experts in this field as much as you are? And we never consider ourselves experts. Like Blake, for example, he is going and getting his, speaking of master's degrees, he's getting his master's in behavioral organization at Harvard currently, and just slowly plugging along at that. But they literally said, hey, you should write a book. And so we wanted to be something that was more of a gift, and something that just share our knowledge. And so it's not really to try to make money off of it or anything. We created a workbook essentially. So it has information and then practical kind of to-do items or homework at the end of each chapter to say, hey, try this out. How does this look in your organization? It's not go buy Pulse for Good. Get anything that makes you better. Test it out, see if it's worth it, iterate, change something, find a cheaper option that does just as good. Any of that is all great. We want people to have the knowledge and the information to get better. And we think that really, if you're listening first, that's the best way to get better.
I want to just read a piece from it. At the beginning of the book, under the feedback problem, I love this example. It says, we want you to imagine someone experiencing homelessness standing in line at the shelter, clutching a small plastic bag that holds everything they own. They've been coming here for weeks, hoping for a warm bed, a meal, maybe even a job lead. The staff work hard to keep things running, but it's hard to ignore the cold, the overcrowding, and the way some rules seem to leave folks worse off. The shelter requires guests to leave by 6 a.m. no matter the weather, forcing people to wander aimlessly. The shelter has a suggestion box, but it's buried in the corner, dusty and obviously ignored. And then it goes on to say, what if? Yeah. What if it were made more accessible? What would you learn from this individual who is in this scenario that hopefully not a whole lot of us have been in? What could you learn? Yeah. How could you improve? How could you grow? And how could you serve? How could you better listen?
Yeah, make it brutally honest that you want all the feedback all the time. So we won't say the perfect way of doing it, but we know there's lots of places to improve.
Yeah. Well, I appreciate your time, Remington. Eliseo, thank you so much. I appreciate you both joining me today. And
thank you so much. Really appreciate it.
Yeah, good luck to all that you're doing and to all of your team. And we'll talk again soon, I'm sure.
Yeah. All right. Go Horizon Services.
Yeah. Thanks so much.
Appreciate it.
Bye-bye.
Bye.
Please visit our website to learn more and to connect with us on social media. Our website is www.horizonservices.org.
Horizon Treatment Services, inspiring hope and healing since 1976.